this topic, the issue of nutrition, it is vitally important to all of us raising children. But what was so compelling to me in having two experts in this area talk to you is that when you're dealing with the symptom issues, the symptom management issues for your children, for the most part, you're deferring to the expertise of a doctor or a therapist who's going to treat your child for those symptoms. It's really having indirect control over what you're doing for your child. What your child eats, you have direct control over. This is something that is really empowering for you. And so to me, it's very exciting to provide you with two experts who can help you with some of the issues that you have surrounding diet and nutrition for children with TM. Anne and Annette, it is my pleasure. Thank you.
It cracks me up when somebody calls me an expert. I'm Annette Bartz. I'm a clinical dietitian at Children's Hospital here in Columbus. This is Weidenbenner. She works for the State Health Department. And I went to tell you, Anne got hooked into this. I was supposed to be on vacation this week, and I said, Sandy, I can't do it. But I know somebody that I can talk into doing this, so I really want to thank Anne. Then when I called back and said, okay, I really am going on vacation the week before, I'll be okay, she said, I'll still come and do it. So we did it together. We thought it was okay. But we're really just going to try to address like the major nutrition issues. I can honestly say I've been at Children's Hospital in Columbus for 17 years now, and I cannot think of a TM patient that I had. Okay, so maybe, I know it's a rare disease. I did talk to one of our dietetic technicians, told me the other day, hey, I had a patient with TM about 6 years ago. So the kinds of things that we look for, we went on your website, we know a lot of the names. We went to the bulletin board, we got an idea of what kinds of things there were, and then we went and did our research to see what we could find. Because there's not specific research on nutrition with TM. Many of the problems that you all have, that you're saying on your bulletin board and your chat rooms and everything, are things that are seen with children with a lot of different kinds of disabilities. So we thought we'd address those kinds of issues. If you have specific questions, we'll be willing to address those, but we really kind of made it broad. And because there isn't any really good research on nutrition and TM specifically, we're really hunting here, okay? So we hope you'll bear with us. And Anne's going to go ahead and talk first.
Good afternoon. Again, I want to, actually thank Sandy for thinking of including nutrition. As Annette mentioned, I work for the Bureau for Children with Medical Handicaps at the Ohio Department of Health. I've been a dietitian there for 8 years, and so I see lots of conferences and lots of programs across my desk on special needs, but very, very rarely actually do they cover nutrition issues. So thank you and kudos to Sandy for including nutrition in this topic. It was a challenge though, because there really is very little out there. So hopefully we'll learn as much from you as we've learned doing the research. The first issue that we'll get into is the lovely topic of bowel and bladder topics as far as it goes, constipation and diarrhea. And what I want to do is try to discuss the nutritional approaches versus the medicinal approaches. Constipation, I think in your notebook there is a handout that says ways to increase your fiber intake. Do you see that in your notebook? And these are some real quick and easy ways that we as dietitians feel it's very, very important to look at your fiber intake first. If you've got some constipation issues, look at your diet. Don't automatically run to the drug options. Look at your diet, and these are some recommendations as far as increasing the fiber intake. The American Academy of Pediatrics suggests that you get 1 gram of fiber per pound of body weight, but no more than 35 grams of fiber. Another rule to look at is take age plus 5. So if you have a 3-year-old child, you add 5, you need about 8 grams of fiber a day. Typical average American gets 11 grams. So you're a long ways away from the 30, 35 that you need. Kidney beans, garbanzo beans are top of the list. Those are really the best way to get increased fiber in your diet. Add them to your salads, have chili, whatever it takes to get more beans into your diet. Wheat germ, whole wheat flour, fruits and vegetables. Have you heard the campaign, Eat 5 a day? Eat 5 fruits and vegetables a day. It's really, really tough to do, but that is what it takes. Fruits, they're listed there. We kind of specified those that have more fiber than those that may not have the fiber. For example, raspberries. 1 cup of raspberries gives you 8 grams of fiber right there. Juices by themselves don't have a whole lot of fiber, but fresh fruits do. You can add chopped dried fruits to just about any of your baked goods. Cereals, it's amazing when you look at the nutritional fact information, the label, when you look at the fiber grams on your cereals, it's interesting how many really don't have that high of fiber content. So when you go through the store and go up and down the cereal aisle, look at that fiber label and see how many grams. It really should have a minimum of 5 grams of fiber in order to be a good source. We listed some of those there for you. Brown rice is a typical way to get some additional fiber in instead of white rice. And then fiber-rich snacks like popcorn. In your crackers, 7 grams or 7 Triscuit crackers will give you 4 grams of fiber right there. So anyway, those are some nutritional approaches to increase your fiber. The next, I think there's also a handout there on can drinking juice help ease constipation. As I mentioned, juice in itself doesn't necessarily have fiber, but pear, prune, and apple juices all contain a natural sugar alcohol called sorbitol. Pear, prune, and apple, those are the 3 juices that contain the sorbitol alcohol, which is not really absorbed by the intestines, which means it's going to attract the fluids and help move the foods through the bowel easier. It also contains fructose, so the 2 juices, the 2 sugars, the fructose plus the sorbitol together are really going to help move things through the GI tract. It's so good at helping ease constipation that you have to watch how much you consume. 1 8-ounce glass of pear juice can contain as many as 7 grams of the sorbitol, so you really do kind of have to watch how much you drink. So that's another option to use. Increase liquids. Anytime you're going to increase the fiber in your diet, make sure you increase your liquids, drink lots of water. Oil in the diet. It's pretty common to see mineral oil prescribed. Have any of you had mineral oil prescribed to help with your the child's constipation? As dietitians, it's one of the things that we have had caution in using mineral oil because there's the thought that it would decrease your absorbability of your fat-soluble vitamins, the A, D, E, and K. So as a dietitian, we'd say, oh, let's try to stay away from the mineral oil and do something else. So as long as I've been in pediatrics, we've always said, you know, you have to watch the fat-soluble vitamins, but then recently, the studies haven't actually been there to prove that. So you kind of have to go with the research and say, you know, maybe it doesn't necessarily do that, but mineral oil is definitely prescribed often. Kind of have to watch, don't use too much of it. It can definitely change the flavor of the food you're adding it to. It can certainly change the mouth feel of the food you're changing it to. It's going to feel different to the child in the mouth, and it will certainly increase the calories. So if you have a child that needs to watch their caloric intake, watch how much of the oil you're going to add to the diet. Okay, on to diarrhea. Lovely. You know, that's right. The dietitians get all the fun things, diarrhea and constipation. But the main thing with diarrhea, I guess first of all, you usually have to define what is, because one loose stool is not diarrhea. It's abnormal, frequent passage of loose, watery stool. Sometimes it needs to be more than 3 within 24 hours in order to be determined true diarrhea. There's acute versus chronic diarrhea. A lot of it depends on exactly what the cause is, if you know exactly what is causing it. The treatment of it usually is giving the oral rehydration therapy, what's it called, solutions like Pediatric. That's a pretty common thing. That's a pretty good thing to give the child as soon as the diarrhea begins. I know sometimes families will give juice, apple juice, if there's a vomiting or diarrhea situation. And as we just talked about, apple juice is one of the worst things you could get for that. There's also try to stay away from your Gatorades, sport drinks, soft drinks like 7-Up. Those juices and drinks that contain sugar are actually going to make the diarrhea worse. Look for signs of dehydration. Look for the eyes and the various things to look for to make sure that they don't become dehydrated. Don't give anti-diarrhea medicines. Those are things that can actually make the situation worse unless they're prescribed by the physician. And then something else that has changed in the world of nutrition since I first started was usually it took them off all foods, give the gut a rest. And now they are saying to keep feeding the normal diet, including milk products. Keep breastfeeding, keep giving the formulas and those kinds of things. That helps the gut stay healthier and helps fight the infection better. So again, it's different than the way it used to be. Urogenic bladder, we had an excellent discussion this morning about that. I wasn't going to go over the bladder situation too much anymore. Just a comment about the cranberry juice thing did come up, and that has been something that's been out there quite often. The latest research that I've seen is that it does increase the acidity, but it does not increase it enough to prevent or to cure the infection. So it's not something that nutritionally that we usually endorse. Supplements. Oh gosh, I hesitate to go here, guys. We'll briefly talk about some herbs and supplements, and we can certainly discuss any questions about this later. But it's a huge, huge issue, huge area. Gosh, been looking through the research. In '93, 7 out of 10 Americans were using the supplement, and now I'm sure it's more than that. In 1998, it's $13.9 billion in sales annually in supplements. $13.9 billion. It's a huge area that has just gone gangbusters. This is a wild time to be a dietitian, let me tell you. It's a really interesting time. The last number I heard was 16,000 different vitamin and mineral supplements are on the market. 16,000. And we have to be able to sort it out, what's right, what's not. But like Sandy said, diet is one area where you've got control. The child has control. And in talking with picky eaters and toddlers in just a typical population, boy oh boy, shut down on that food department before anything else because they have control over their mouth and their food intake. So it's not just children with special needs, it's every child. They have got control over their food, and it becomes a huge behavior and power issue. So supplements, we're all looking for a cure. You know, what if? And why not? Just in case, you know, maybe this is the one supplement that will really do the trick. And again, looking for that sense of control where you've got the ability to show your own destiny there. Natural versus synthetic, that is not necessarily the case. You're willing to pay more for a natural product, but you know, in biochemistry, vitamin A is vitamin A, and it doesn't necessarily mean that the natural product is going to be any better than the synthetic. There are exceptions to that as far as the bioavailability versus, for example, folic acid is more bioavailable in the pill form versus the natural food form. Perceived lower cost of care. If you take the supplement, it's going to potentially avoid a longer, costly health treatment. Bladder caps. Have any of you heard of these? Are any of you using them for have them for your child. Which one? They're called, it's the first I can't pronounce, Sanhelios curbita bladder caps. And it's used for strengthening the bladder and produces a calming, harmonizing effect on the function of the bladder muscles. I thought, well, that sounds pretty cool. And basically what it is, it's the oil from pumpkin seeds. But you only need, as far as the dosage, is 1/3 of an ounce of pumpkin seeds is what it would equal to. You can also buy this in a pill form. A gel capsule, the same amount, would cost basically $2 a day. You can take that $2 a day versus the 1/3 of an ounce of pumpkin seeds. It's less than 25 cents a day. So you have to consider the cost of purchasing the product versus being able to consume it for much, much less. Vitamin C, this was just one of the nutrients we picked out based on chat rooms and various resources that we have. We thought that this was a supplement that was used with the TM population. It does help maintain skin integrity. It does help heal wounds. It's important for the immune function, which I think is probably the important issue. But there's no research at this point to show that the high supplements improves the healing in the healthy people. So you need to watch the extra high doses that may be used with that vitamin C. What's your recommended? The RDA. In fact, the most common side effect of too much vitamin C is diarrhea and GI disorders. So you really kind of have to watch it. There's, I think in your notebook also I hand out vitamins that are often used as supplements. There's a vitamin C, the RDA for, gosh, 4 to 10-year-olds, what'd you say? 45? It's hard to remember all this. So it's about 45 milligrams is the RDA for a 4 to 10-year-old. Okay. I think I'm going to keep moving as far as vitamins go. Talk all day on supplements. Transfer factor. Any of you have heard of this? You can admit it. It's okay. You can tell me. I got this from one of the moms that said that this was something that she was using, and please let us know what you find out about it. Well, let me tell you, we've got very, very thick books on supplements and all kinds of herbal things, and I subscribed to a couple of newsletters and could not find this. This was a tough thing to find. But when I did find a little tidbit about it, it's used to improve the immune system. So again, I can see where it would be popular. It comes from animals, specifically cows. Very little information available on its effectiveness. There is a concern that because it does come from cows and not necessarily knowing where the cows came from, that there is the potential to have mad cow disease associated with it. Where I did find it, it's used in the AIDS population to help improve stool frequency, but could not find anything where this particular supplement is effective for anything else. Okay, what you need to know, natural doesn't necessarily mean safe. Again, when you get into the bottling of the supplements, natural doesn't necessarily mean that it's okay. Herbal, pharmaceutical, and herbal interactions is a huge area. Boston University did a study. They found out that 1 in 6 individuals are taking both a prescription drug and an herbal supplement. 1 in 6. We don't know what happens between herbs, let alone herbs and prescriptions. So, most of the time, my experience is people aren't just taking one herb and one supplement. It's multiple. And the research just isn't there to see what happens when you put all of that together over a long period of time. Lack of standardization, variable results. There really is no standard product. I mean, it depends on where the product was grown, the plant was grown, how it was processed, all of those kinds of things. It's a totally unregulated area. So you can get one bottle one time that's going to have varying level the next time you purchase that same product. Contamination can occur, especially with heavy metals. In fact, that if there's been lead in the soil, some of the lead has been leached into the supplements, and so you kind of have to watch if it's been contaminated. Lack of information about use with children. Again, this is such a new area. There's very, very little information on its effectiveness with children and the safety long term. Okay, recommendations: don't use more than what is recommended on the package. That's the safest thing to do, is don't exceed what the dosage is on the bottle. Again, long-term safety is not known. It's just not there yet. We're looking at it. We're doing what we can to keep track, but we just don't know long-term. Avoid herbal treatments with known adverse and toxic effects. I don't know if you've heard of the whole ephedra thing. And ephedrine and Ma Huang is the other name for it. If you've seen that in the supplements, especially within the athletes, the NFL has completely banned that particular supplement. So watch out for anything that has ephedrine in it. Check with professionals before using herbal treatments with children. I know it may be difficult to confess or admit that you are using a supplement, especially to a dietitian, but please, please do. It's very, very important that you identify all of the supplements or herbs and vitamins and everything that you are taking to your healthcare professionals. You know, since this is such a new area, you may find a dietitian or a physician that is not really wanting to listen to what you are taking. They're going to poo it and dismiss you. Keep on going, keep on asking. Like I said, I'm a member of the practice group within the American Dietetic Association that is devoted just to complementary and alternative medicine. So, and there's an awful lot of professionals that are looking into this because we can't ignore it. So we're becoming as educated as we can on the whole issue of supplements. There's just an awful lot out there, but keep going, keep asking, and find somebody that you can trust and talk to that's in this area, that's a health professional, and make sure that your physician knows. Gluten-free diet. This is another thing that we got off of the chat room. Again, I'm not sure if anybody here has used it or is thinking of using it for their children. Again, I think there's a handout in your notebook about this. But the gluten-free diet is something that has been used for patients who claims that it does help with the symptoms. And gluten is, if you're not familiar with it, it's the protein that's found in wheat, rye, oats, triticale, and barley. So it isn't just a wheat kind of product. Gluten is found in many, many different products. It's mainly used for children and kids, adults with celiac disease. So celiac disease is a huge, huge disease, but they absolutely cannot have any gluten at all in their diet. But that's where it's used, and that's where it's the only place where I found where it is totally effective. Couldn't find anything in its relationship to TM. Again, we're blazing new trails here. I could not find anything to where it will help the TM population. It's extremely restrictive. If you know anybody with celiac disease, talk to them about their diet. It's a whole new world. To completely stay away from gluten is a huge challenge. It's not just in bread products. They have to watch what medications and toothpaste and mouthwashes and all kinds of things that they have to take. So it's not an easy diet to follow. As long, it's kind of like with any special diet or any supplement, as long as there's enough calories to support growth, you could go ahead and try it if you want to. I talked to the dietitian here in Columbus that does celiac disease, and I said, have you ever had this for a child with TM? And she said no. But her approach is try it for a month. If you can do it for a month, and if you see some benefits, then, who are we to say no? So, try it for a month, see what happens. One of the things that was mentioned in the research that's on the handout there is that if it does benefit someone, it could be that they definitely have undiagnosed celiac disease. Maybe that is something that they actually do have, and they have symptoms relieved because of the special diet. The same goes with a lot of things. Maybe there are actually food allergies that the child has never been diagnosed with, and when they eliminate that particular thing, then they all of a sudden do feel better. Yes?
I'm not on the chat room, but what are the symptoms that some people have reported disappear or it helps with?
It's mainly GI. A lot of times it can either be the vomiting or the diarrhea. Respiratory too? Is that right? It was usually GI symptoms that we see within the celiac. Did you have a question in the back?
That was the same question.
Okay, great. Oh, I'm done. It's Annette's turn. Oh, let me. I know, Annette's got to clean up after me. I do have to refer to the another handout that's in your notebook as far as this is what you were going to do.
You have two other handouts in your notebook that should be helpful. One of them is from Center for Food, whatever. It says dietary supplements on it, and it talks about what a dietary supplement is. Do I need to use this? What a dietary supplement is. One of the things that you need to know, the reason we even talk about caution with dietary supplements is the laws are different for medication, for drugs, than they are for dietary supplements. With a drug, before you can use it in people, you have to do studies to show that it's effective or not effective. With a dietary supplement, it's the exact opposite. You can use it, and then when they find out that it's maybe harmed several people, then they're allowed to pull it off. I know it sounds really backward, and when you consider that most drugs started out as a plant, or there's something they found in a plant, and then they've had numerous little changes on there. That is something that you need to think about. They are potentially the same kinds of drugs that you're getting someplace else. Okay, so the research isn't done until after. It's like an after-the-fact thing. Different countries do different things differently. In the United States, you don't have to do the research. It goes afterwards. There's a big Commission E that's in Germany that has a lot of research. Again, it's all after-the-fact research that shows, okay, people have been using this for a long time, it doesn't seem to have caused any problems, so that's okay. That's where we come from when we say, ooh, you really got to be careful with these dietary supplements. It's from that, the fact that the research is not there, and it's not going to be there for a while. Now, and the other reason about that is when you have medications, it's to the drug company's benefit to get this stuff tested because then they can put it out on the market. For a dietary supplement, why should those drug companies, and many of the dietary supplements, even though you may not recognize it, are really made and manufactured and put out there by the drug companies. They have a different name, they'll call themselves natural something or other, but it's really Pfizer, it's really one of the other drug companies that's backing it. And they don't have to do all that research, so they don't have to put money into the research and development part of it. So it makes it easier for them to get this product out there. I really want to make sure that you know that Ann and I aren't saying don't use dietary supplements. We're not telling you to go out and use them either. But what we're going to, when a patient comes to me and says, I want to use this with my child, the first thing that I do is look up and see what the research that's available is. Is it harmful? That's the big thing. Do no harm. If it looks like there's no problem, it's their choice to use it. I'm not going to recommend that they use it, but it's their choice to use it with their child. On the other hand, if I find something that says this can be a real problem, I was telling Ann there's one, and I can't remember the name of it for the life of me, but it's one that you put, it's an herb that they make into an ointment and put it on babies' heads for cradle cap. You all know where cradle cap is? And the baby gets all kind of scaly on the top, like a psoriasis kind of thing. It actually is absorbed through the skin and then can cause some problems with the bilirubin. Remember, babies, when they're real young, turn kind of yellowish sometimes because they can't change that Billy Rubin over. And so there are some problems that can be associated with these things that we don't necessarily think right off the bat that this is a problem. So really what we're saying is, be careful. Look at all the information you have. The two other thing that you have that's a handout there is from Emory University in Atlanta, and it's how to evaluate a website. And the reason I bring that up now is because most of these herbal preparations are sold over the internet. A lot of them are sold over the internet. How do you know when you go and click on this internet site, is this something that really is legit? The information that they're giving you, is it legit information, or is it because they're trying to sell you something? And that evaluation form helps you kind of go over that to decide for yourself whether this is something that you can think, okay, maybe this is realistic. I brought with me National Medicine's a comprehensive database. It's $95, I think now. It's put out every year. And I'll leave this up here if you can't take it, but you can look through it. All the herbal supplements that have been studied are in here. Now, there's stuff that's not in here because it's not been studied. They have everything referenced. They'll tell you whether it's safe, what it's supposed to do, what it's not supposed to do, whether it's safe with children or not safe with children. You know, if it's not safe with children, they'll definitely say it's not. It depends on what studies have been done. There's a lot of information in here. I recommend that you find something like this. They make a database, and you can buy it to put on your computer. You can go to your local medical library and see if they have this or something else that's like it. We use it a lot in the nutrition section. It's the only section at our hospital that has access to it, right? Well, it doesn't have access. We have copies of it. The rest of the hospital can use it. The pharmacists, use your pharmacists, because they know a lot of this stuff. They know what this is. The names of these things are a certain kind of drug. Okay, so I brought that with me. You're welcome to look through that. Do they have that one? The natural one?
It looks like that.
Okay.
They'll flip through to tell you all that they know about it.
Okay, but that's not always necessarily all the research. You really need to be careful because the health food store is there because they're selling you this stuff. Okay, they want you to buy it, so they're going to put you the stuff that makes it look like it's good. For the most part, this comes from a database of physician and drug companies, as well as pharmacists, as well as the national government. It's mainly the national government is sponsoring all of our research now. I'll talk about that in a second. It's under the Office of National Center for Complementary and Alternative Medicine through the National Institutes of Health. And a lot of that research that's come out is coming into this database. This one is called Natural Medicine. It's a comprehensive database. What I'm saying is look at the book and see who put it out. You know, if you went to go to the health food store and you went to GNC and GNC says, here's a book on all this stuff, and it's made by somebody who owns a company that makes all this stuff, it may not have all the information that you want. There are a couple other places that you can go for reference sites. One is, they're both in the National Institutes of Health, because as I said, the drug companies aren't giving the money out for this stuff. The people who are giving the money out right now in the United States is the National Institutes of Health. They're giving out a huge study, a 10-year study across the country in different places to find out about all this stuff. Go into www.nih.gov. Click, I have to do it this way because this is the way I always do it, and I know there's a different way you can do it, but nih.gov, click on Institutes and Offices. When you get in there, there'll be one called Office of the Director. Click on that. From there, you can click on Office of Dietary Supplements. Now, that leads you to a whole bunch of stuff because they have a database of all new literature that's being done, all research that's being done. Okay? You can also get to that same database by going into www.nih.gov, click on Institutes and Offices, click on NCCAM, National Center for Complementary and Alternative Medicines, and that'll hook you up to that database too. So you're not dependent totally on going to somebody who really doesn't know anything about supplements, dietary supplements. But you can go in and look at the research and say, you know what, this is used with MS. Would it be something that I could transfer to TM? Okay, so that's about the best way you could do your own research. But don't just do your own research, because I can tell you quite honestly, these are pretty scientific journals that they're coming from. First of all, you're not going to have access to some of these journals. And secondly, you may not be able to understand what it's saying to you. I'm not saying you're not intelligent people or anything like that. I'm just saying we use a different lingo than, in the health profession that sometimes other people do. So take your article to your physician. Say, would you read this? Tell me what you think. Ask them to evaluate it for you. Okay, that really does help. I wanted to point out one more thing. The woman that was sitting next to me, and I'm sorry I don't remember your name, handed me something called myelin sheath support, and it's a tablet that has several different B vitamins, has calcium, magnesium, zinc, selenium, has a whole bunch of minerals in it. And she asked me, what did I think of this? And I'll tell you, the one thing that immediately jumped out at me is because you won't see RDA, recommended dietary allowance, on a lot of stuff anymore. Now what you'll see is DV, daily value, which is really kind of RDA, only they changed the term on it. Right off the bat, I can look over at vitamin B12. The daily value percentage is 2,670. That's way, way high. And that's for an adult. The daily values are for adults. Kids are not just little adults, and you really need to pay attention to that. We don't just take all of the nutrients and go, okay, half. They only need half of that. We really do look at everything else that's going on, because kids need certain amounts higher, maybe because they're growing, maybe they don't need a certain amount of this because they're not menstruating, and there are all kinds of things we look at. So even if I halved that, which I'm telling you not to do, that's still 1,000, over 1,000, 1,200% higher than what we would recommend. There's a reason the recommendations are there. The studies have shown that in some cases, if we overload these vitamins and nutrients, minerals, we can cause toxic effects in these kids. All of the daily values and the RDAs are all padded, okay? So you really want to look at what you're doing and what you're taking. Anyway, throw that one out. I wouldn't use this. Okay, the drug and the nutrient. I'm going to do this up here. Okay, one of the things that you need to recognize with drug and nutrient is that there can be lots of different kinds of interactions. They can change the way that the nutrient is absorbed from the gut, and that's a real key thing. You have to make sure that the nutrients we're giving are really going to be absorbed for your child to grow. Sometimes the nutrients can cause some problems in how the uptake of the nutrients are, but sometimes they cause problems in the way that the child expresses their hunger or doesn't express their hunger. Sometimes they may not be hungry. They may have an anorexia, not like anorexia nervosa, but just anorexia just means I'm not very hungry. So they may have that kind of thing. They may feel extra hungry. It may change the taste of how they taste foods. It might make them more thirsty. There are lots of different things that could happen. Because I've got a lot of drugs in here, and I didn't throw all of them in, I just threw a bunch of them in. What I thought I would do in case we run out of time was to go over the kinds of reliefs that we can do first, and then we'll talk about the drugs, and if we get cut off, that's fine, then you can look in your handouts. One of the first things that happens is you may get a change with some of these medications with the taste and the smell dysfunction. Taste and flavor is not just taste, but also smell. When you taste something, it goes back up into the back of your throat, into your nose, and all of that affects how you taste something. In fact, we know that that fetuses can taste all kinds of stuff in the mother's amniotic fluid. They don't open up their mouth, or they might open up their mouth. They're not breathing through their nose. There's a lot of stuff that's going on back in there. So sometimes the medications can change the way something tastes or smells, and that can make a person not want to eat a certain kind of food. One of the things that you can do is mask the taste of the food with something else, and if you've got a yucky tasting medication or something like that, or a yucky taste, something tastes awful, but you want them to get that nutrition in there, ketchup's a good thing for kids. Kids like an American cultural food. Throw ketchup on stuff and they can taste it. Pick something that's really something your child likes and mask the flavor with that. If it's something that's affected the taste of the food and they still want to go ahead and eat it because they, I don't know, maybe they really do want it, you can use in the mouth some gum or some candy, lemon juice to mask whatever that flavor was afterwards. Some children will have reflux and will actually burp up some of the stuff, and that, it tasted good going down, but it doesn't taste good coming back up. Okay, so one of the things that you can do is give these mints and the candies and the stuff like that to try to get rid of some of that flavor also. Oh, that's an interesting one. Okay. I put random effects on a lot of them. Encourage good oral hygiene. And the reason that we bring that up is because if you have poor oral hygiene, sometimes those, the microbes that are in your mouth can cause you to have different tastes in your mouth, whether or not it's not from the food necessarily, but it might be from just the oral health that you've got, the gum health more than anything. So yeah, make sure they brush their teeth and they floss their teeth. If there's a loss of appetite, which happens with a lot of drugs, somebody doesn't feel like eating, make sure that the food they have has high calories. And the easiest way to do that is to increase the fat content of the food. Fat has the highest number of calories. That's an easy way to do it. Look at your nutrient labels and say, gee, I've got comparison of one kind of brand versus another. If I use this other kind of brand and he's only going to eat B pieces of this, I'm going to go with the one that has the higher caloric density. I've had parents come up to me for years. I've worked with developmentally delayed children. And when I say add fat to their diet, they go, oh, they'll get a heart attack. Well, and this is going to sound really crude. I want them to live to be old enough to get a heart attack. So my bottom line is go ahead and put that extra fat in there if they need the calories. That's what we're really looking for. And choose a food that has naturally more calories in it. Oh, you can use supplements too, like in our country, I don't know what they've got in Denmark, but Pediatric and Kindercow, Peptamen Jr., there are all kinds of different supplements. Now, my guess is that most of your children are not on supplements, but may have been at some point in time. Okay, you can enhance the flavors if they're not really hungry. Sometimes smell and the initial taste can increase how likely they are to continue eating the food. So pick something that you know is one of their favorite flavors and try to put that flavor into that food. Provide for variety. One of the easiest ways to get a kid not to eat is to feed them the same thing day after day after day. Now you're going to say to me, my 4-year-old only eats the same thing day after day after day after day, and that's okay because that's what 4-year-olds do, and that's quite, they can tell you, I'm going to eat the same thing day after day after day. But once they hit that wall and say, I'm not going to eat this anymore, that's when you wish you would have done variety. You can always offer variety. They don't have to take it, but always offer it to them. Pleasant eating environments. If your child is not somebody that is very hungry and you're trying to get calories in there and you've got the TV on, chances are they're not going to pay attention to eating. They're going to pay attention to the show, and they're not going to eat a whole lot. So you want to make the environment pleasant, but you don't want to make it distracting. Now, some other kids do better when they're distracted, so you really need to evaluate your own child. But oftentimes, the least distractions you have, the more chance you have of eating. Also, feed them when they are the hungriest. Feed the most calorically dense foods. Okay? Don't give them, Kool-Aid at the beginning of the meal when they were really hungry, when you really wanted them to eat that piece of meat because it had some higher calories and more protein in it. And small, frequent meals. We know children especially are intimidated by how much is on their plate, and adults sometimes use adult serving sizes and put those down there, and of course they're not very hungry anyway, and you put all this food in there, and immediately they're going to shut down and go, you wanted me to eat all that stuff, I can't eat it all. So the best thing to do is to put smaller amounts on there. Let them ask for more. And then because you didn't overwhelm them with the visual cues that say, I've got to eat all this stuff, I can't do that, you're likely to get more food out of them. And offer it frequently, not every 10 minutes, and don't become short order cooks. But it takes about an hour to an hour and a half for food to really get through the stomach and into the intestinal tract and for you to be able to be hungry again. So at least an hour and a half to 2 hours would be a real good time frame of offering more food. Okay, some children, some drugs and medications will cause epigastric distress. That means the reflux is coming back up. Well, quite honestly, if you're a 2-year-old and you're having a lot of stuff coming back and you don't always see it come out, it can like sit in here and go up and down a lot, and you may never realize that they have reflux. And some of the drug may be causing that, and what they will say is, I don't want to eat, or I don't like that food, I don't want to eat it. And you're thinking, I don't get it, they look hungry, what's going on? It may be that they just have this reflux. Would you want to eat something that was burning your throat all the time, coming up and back down? No, you wouldn't. So you really need to pay attention to the drugs. If your drug is saying there's epigastric possibility reflux, whatever they want, heartburn, whatever they want to call it, then you want to pay attention to that. Notice if they have any wet burps, if they're young enough that you can notice that. Ask them if they're older and you have it. Okay? Keep them upright. Look at the foods. Some foods cause that heartburn more than other foods do. Usually foods that have caffeine in them, foods that have high spices like Cayenne pepper will cause that sometimes. Sometimes foods that are high in fat. The foods that bother children are individual, so you need to work with your kid to find out what's going to cause the problems. Small frequent meals, there we are again. And extremely hot and extremely cold foods can cause that reflux. And I've had some parents before that have said, well, you know, he said his throat hurt, and we know it's because of reflux, because we'd already diagnosed the reflux, and so we gave him ice cream. Well, that's probably not the best choice, because it's a pretty cold food, and it probably will cause some reflux. So, yeah. Okay, we're going to go on to the kinds of drugs. I'll start with the antibiotics. I'm not going to go through all this stuff, because I know we're running late. So I'm just going to tell you, the really big thing about any of the antibiotics is almost all of them cause GI problems, either diarrhea, reflux, that kind of stuff, and all those things we talked about, ways that you can alleviate that will help. Sometimes food decreases the absorption of some of the drugs. You need to look and ask your pharmacist is your friend, go back and ask them, what can we do? Is this the kind of food that I need to take with food or without? And pay attention to that. Okay, amoxicillin is another one that causes a lot of problems with diarrhea and nausea and vomiting and GI distress. Make sure you drink lots of fluid. Azithromycin. If you take azithromycin with food, it decreases by half, by 52%, how much of that drug is absorbed. So you really, like, you know, amoxicillin you may want to take with food, the azithromycin you don't want to take with food. You want to really look at that and see what you're supposed to do. Okay, the GI drugs, the ones that now you've got that reflux, because of something else that was going on, and now you're saying, okay, I want to have something that's going to counter that reflux. So the doctor says, put the kid on Zantac, go ahead and put your child on Zantac, and everything's fine. You do want to kind of watch this, because with Zantac you can cause vitamin B12, to be decreased. Let me think what else do I want to put in here. A lot of times the diet's a bland diet, and that goes along not with the drug so much as the fact that the reason they're giving the child that is because of the reflux, and they're trying to get all that out. That's why they limit the caffeine. It's really more the symptom than the drug that we're dealing with here. Okay, the central nervous system drugs, the ones that you really need to be careful of. Your child is on any anti-seizure medications, anticonvulsants. Phenobarb is one of the ones that we really watch out for. Phenobarb can really block the folate, folic acid, folate, whatever, it's a B vitamin. It can block how that is taken up, and you can get something called megaloblastic anemia. It's not iron deficiency anemia, but it has some very similar kinds of problems with it. And you want to make sure that you're getting that folic acid someplace. Okay, so with somebody who's on long-term, especially phenobarbital, we probably would say to that person, you need to have a folic acid supplement. It can be part of another supplement, but it needs to be there. Vitamin D and vitamin K are also problems with long-term use, and we I a lot of times have seen long-term phenobarbital use. That somebody put them on initially on a phenobarb, and then they left them on, and nobody ever took them off. So it's really something that you need to kind of monitor and look at. So with the phenobarb, we'd say vitamin D, vitamin K, and folic acid we really need to watch out for, and B12. And C. There's a lot of stuff with phenobarb. It's not a nice drug. It can increase, or vitamin B6 can decrease how much the drug is used. Okay, so it's not just what you need, but what can also affect the other components or the other nutrients. And the other really big thing, more than nausea and vomiting with phenobarb, is constipation. It's got a real strong correlation in there. Dilantin is oftentimes used once we take children off of phenobarb. The next one is usually Dilantin. And one of the things that I did put it here. Dilantin is really well known for causing gum hyperplasia. In other words, the gums get all swollen and don't feel real well. It hurts to eat. And so children who are on long-term Dilantin use may stop eating, and you're thinking, I don't get why they're stop eating. They were okay before. Well, their gums hurt, and when their gums hurt, and their teeth hurt when they go to chew. So children with Dilantin may not have really good oral intake because of that. Let's see. Keep on going so we can get out of here. Neurontin, I have to be back at the hospital So that's why I'm kind of weird here. Neurontin, the big things about Neurontin is really that it can increase the appetite and increase weight. One of that reasons has to do with it can increase the fluid retention. So it looks like you're gaining a lot of weight, but really it's more fluid. It can cause dry mouth and throat and stomach upset. The antidepressants, let's see what I really want to talk about on this one. You have an increased need in B6, or B2, which is riboflavin. Okay. Just because you have an increased need doesn't mean you have to go to the vitamin and mineral supplements. You can get riboflavin from milk. Okay. You can get riboflavin from a lot of the fortified cereals. You can get a lot from fortified cereals. And the other one about this one is the constipation diarrhea gas. It's another one. Okay, so more antidepressants, serotonin. The Prozac, Zoloft, and Paxil, they're kind of lumped together. They're not exactly the same kind of drug, but in terms of nutrients and what it does to the body, it can cause about the same kinds of problems. Most of these you use separate from the time when you eat the food. You can have anorexia and then a possible weight loss with these. I know, this is horrible to say, but I know a coworker who went to the doctor and asked if she could have this because she wanted to lose weight. So it does work. All the other ones that we talked about before, Xanax and Clonopin. The big one here, I think, is it can do weight loss or weight gain, and you really need to evaluate your individual child to see what's going on there. The over-the-counter laxatives, which I know a lot of people who have bowel problems will go to the over-the-counter kinds of things. The things that you really want to make sure with these is that you have calcium and potassium stored in supplements along with them, or intake of calcium containing foods like milk and dairy products, and potassium containing foods, which are every fruit and not every, but many of the fruits and vegetables that you can use, because you're going to have increased intestinal loss of potassium, especially because same thing like when you use mineral oil too. We were talking about that anymore we don't automatically say no, don't use that, but you do need to recognize that when you have more stuff going out at a faster rate, you have less time for things to be in there to be pulled out for absorption of the nutrients. Antispasmodics, Ditropan. The big thing on here is, more than anything, is the decreased GI motility. The gut moves slower, and because it moves slower, there can be increased constipation. The way that constipation works is everything goes from your stomach into your intestinal tract, and the faster it moves, the more liquid it is. That's why when your child has diarrhea and he's going through there really fast, all this liquid is being lost. When it's there for a longer time, the body says, hey, I need some of that water, and it pulls it out of the intestinal tract. And so you have more solids in there and less liquid, so you get constipation. So this decreases how fast everything goes, so you're going to end up with constipation. Okay, steroids, another big one. Prednisone is a really good example. This is go look for. I will say, calcium is only absorbed up to a certain point. Most of the time, if you have more than, I can't remember if it's 500 or 600 milligrams at a time, I think it's 500 at a time, your body won't absorb it. So if you give all your calcium supplements in the morning, forget it. It's not all being used. You have to space it out over the day. So that's really key. If you're giving regular multivitamin mineral supplements and it's got calcium in it, don't give the calcium supplement at the same time. Give it at a different time. Lactose, which is the milk sugar found in milk, and it's not too much in cheeses, it'll be in yogurt a little bit, but it's mostly in milk, increases the absorption of calcium. So if they're going to take it, you can give it to them with milk. It's, you're still going to get not all of that calcium taken up at the same time. Okay. You always want to make sure that any steroids are used with caution with diabetics, because it increases the blood sugar level. I've got all these things on lactation just because I thought, well, I throw that in so that you know eventually that almost all drugs, not all drugs, but many drugs, there's a caution with lactation. But I can honestly say, if you look at the American Academy of Pediatrics Committee on Drugs, they pretty much say a lot of drugs we can use with the lactating women. So your teenagers who are eventually going to have sex, as the woman was talking before, and then have babies, can, if they're on steroids can go ahead and breastfeed, but they really need to make sure that they're checking it out with their doctor. And we almost always recommend a multivitamin, multi-mineral supplement for children that are on steroids. Okay, any questions?
The calcium intake, I know that it's going to really cause problems with constipation.
You know, she asked, when does calcium intake get high enough that it will cause problems with constipation? I would have to say, and come up and answer this. I would have to say that it's an individual thing. I can't tell you when you get to 1,200 milligrams a day that's going to cause a problem. What I've seen professionally, and I don't have the literature base to back this up, but what I've seen professionally is the kids who are taking it all at one time, which I told you before doesn't work because you're not absorbing it. Those are the ones that usually have some problems. It has more to do with everything else and how fast the gut is moving than anything else. So you're really spacing it out. You're going to get more water if you're getting a calcium supplement. Same if you get the water, you take the supplement. So really pushing that fluid more than anything should help. But calcium itself should not be the reason that calcium or that constipation occurs.
We're only going to have time for one more.
It's the only thing they missed. Active cultures, yogurt, near beer,
Active cultures, and what do they do?
Yeah, I mean, it doesn't seem to have helped our son since he has, bowels that move slowly sometimes.
It doesn't, or it does?
It does.
It does.
It helps.
Live active cultures have been shown to cause an increase in your gut flora and fauna. And that, anytime you have an increase in gut flora and fauna, that's the all those microbes, all those little friendly germs that are down in your gut. Actually, that does help utilize some of the nutrients down there. It also helps break down some of the carbohydrates. So it can be very good. Is it mandatory? No. You need to look at your labels because some of the stuff, not all yogurt has a lot of culture in it. It's not going to hurt you. As I said before, do no harm. That's the big thing.
Thank you.
Okay, Ann and I will be up here for a little bit. You can come up and ask questions if you want, but we can take a break, right?
We are. Let me thank you both very much.